You are called to a private residence for an unknown medical situation. Upon arrival, you are met by the door by the patient's niece, who tells you that her elderly aunt has been sick with the flu for a few days. She came to check on her aunt today when she could not get to her to answer the phone. When she arrived at the house, she was unable to arouse her aunt and called 911.
Okay, so we would have proper PPE. Is our scene safe?
Yes.
I'm going to assume this is a nature of illness. We only have one patient?
Yep.
Because we really don't know what's going on quite yet, I'd probably call ALS just to have them on hand. But I don't think we need to consider C-spine. My general impression is going to be an older lady who is unconscious. So her chief complaint is going to be unconscious or altered mental status, and then probably her flu-like symptoms that she's had. What's her level of consciousness? Is she alert or unresponsive?
Responsive to painful stimuli only.
Is her airway open?
Yes.
What is her rate?
38 breaths per minute.
What's her lung sounds?
Clear and equal bilaterally.
SpO2?
94.
Okay. Just because she does have altered mental status, we will put her on oxygen. Probably with a nasal cannula at this moment. And we'll just start her off probably at 2 to 4, just because she does have a really high SpO2. I'm assuming she's going to have a gag reflex because she's responsible for painful stimuli. So we'll put in a nasopharyngelic airway. She's breathing really fast, but at this point, does she have a fruity odor to her breath?
Yes.
Yes, we're definitely not going to try to slow that down because she's trying to get rid of the extra sugar she's got, because that's probably ketoacidosis. Does she have any major bleeding?
None.
What's her skin color?
Pink, warm, and dry.
Her pulse?
.90 beats per minute.
Okay. What's her glucose reading?
High.
Okay, so she's definitely a priority transport, and we'll definitely want to get ALS here as soon as possible. What's the onset of this?
Niece says her aunt hasn't been feeling well for the past several days.
Propagation, quality, radiation, severity probably don't apply, correct?
Yep.
Time?
3 to 4 days.
Okay, so we can't answer any other questions related to that. Does she have any allergies?
Cardiac die.
Okay, is she on any medications?
Aspirin, levothyroxine, and insulin.
Okay. Any past medical information, pertinent medical information?
Shingles, thyroid problems, and diabetes.
Last oral intake? Do we know that?
Unknown.
And then events leading up to illness.
Laying in bed and not feeling well.
Okay, so this is probably definitely a neurological thing. This could probably also turn into neurological and cardiovascular / pulmonary based on how high her blood sugar actually gets and how long it lasts. So we definitely need to keep an eye on that and get her to ALS as soon as possible. What's her blood pressure?
118/54.
Her pulse?
90.
Respiratory rate?
38.
Is her breath sounds equal?
Yes.
Her pupils pearl?
Yep.
Okay, so my field impression is going to be a older, elderly lady who is probably in diabetic ketoacidosis. Interventions we have done are oxygen and insert an airway to help. We don't really need to worry about slowing anything else down, and we can't do much else without medical direction or ALS there to help. I'm definitely going to monitor this patient every 5 minutes to reassess her, and then keep an eye on her SpO2 and her heart rate and level of consciousness. She deteriorates or improves or anything. And then when ALS arrives, or if we get to the hospital before that, we would let them know that our glucometer, whatever you want to call it, read high. So we have an unknown blood glucose, but we definitely know it's high. That we gave her oxygen. We started with 2 liters per minute and readjusted that as necessary, and that she does have a nasal airway in just to help keep her tongue in place so it doesn't block her airway.